What's up, sports rehab experts? Today we're going to be covering a hip labrum injury. So if you're a clinician who is dealing with athletes who have hip labrum issues, or orthopedic patients who have hip labrum issues, or if you are someone who enjoys exercise, you're an athlete and you're trying to do some research on how to best rehab a hip labrum injury, this video is going to be for you. Full A to Z process that we go through here at Sports Rehab Expert. So 3 considerations that I want you to have when you're in rehab. So if there is a hip labrum injury that is truly happening, again, if you're just an athlete or a person who enjoys fitness and you're not sure, you should get it checked out by someone to confirm that there is a hip labrum injury. There's different testing you can do, but oftentimes there's a clear mechanism of injury. If there is not a clear mechanism of injury behind the hip labrum injury, we need to ask ourselves if there's some hypermobility that could be causing part of this tendency to hurt the labrum structure as part of that reason, or overstretching possibly. In some instances, there's stiffness, and that can be a culprit of why someone might hurt their labrum, but oftentimes, more than not, especially if there is no mechanism of injury, it has to do with hypermobility. If there is a clear mechanism of injury, then we know why it's hurt, and we need a game plan how to address it, and that's what we're going to cover here. So there's 3 different reasons why you may have pain. You need pain here from a hip labrum standpoint. You need to understand which one is your circumstance. If there was a mechanism of injury, you need the right amount of rest and specific tissue training to rebuild that capacity back up again. So loading in the form of isometrics, concentric and eccentric training, and eventually progressing your way back into impact training or plyometrics, possibly stretching if you're dealing with some stiffness, but that is oftentimes based upon range of motion, which we'll cover in this lecture, how you can determine that. Because again, if you have hypermobility and you think that's part of the reason why this labrum was injured, then we're going to focus more on isometric and concentric contractions. Eccentric or lengthening of the muscle and impact are going to be later on, but we have to be much more cautious and careful with the eccentric type training if the person has hypermobility. Stiffness, again, is the least common. That is going to involve a lot of more isometrics and concentric training again, but will also involve more eccentrics. Think of that as stretching as progression to eventually get someone to impact training. A couple mistakes that I see is too much emphasis on stretching early on. So this is why you need to determine what is your archetype as a human being and what could be your mechanism of injury, or if there's hypermobility behind the injury, because if you're stretching and you're hypermobile, that's not going to end well. Also, if you're stiff and this labrum issue is acute, meaning early on in those stages, and it's hot, it's painful, and you're trying to stretch that, oftentimes that doesn't work as well too. Stretching should be at the very end stages of your program. Unlike most PTs who are misled, who get you to stretch right away when the injury is really, really painful, oftentimes that stretching just makes it worse. So be aware of that. Make sure you're going to someone who knows how to address these issues, and you're not going to just some average Joe PT who doesn't know what they're doing and they give you some cookie cutter sheet of exercises. And then finally, highlighting the impact training here, because I think it is the key to return to sports or high level fitness, but it needs to be scaled appropriate to someone's capability. It is often the most forgotten part or missed concept in rehabilitation. Proper impact, the volume and intensity behind programming these exercises. We're going to talk about some exercises later on in this lecture, but that's what takes somebody from 80% better all the way to 100% better, and ultimately gets them back to playing their sport if that is your goal, getting back into playing a sport after hip labrum issues. So 3 solutions to those 3 problems. We have to first and foremost manage somebody's symptoms. So decrease symptom volatility by avoiding aggravating factors. Oftentimes those aggravating factors are a stretched position, which is why I don't recommend stretching, even if you are a stiff individual early on in a rehab plan for a hip labrum issue. There should be just a very general recommendation here. There should be no increased pain or 24-hour lingering symptoms above your current baseline level of discomfort when you perform an exercise to start getting the approval to start gently stretching. Likewise, your pain should also be at rest 0 to 3 at the most. If your pain is over 3 out of 10, 10's you got to go to the ER, 0's no pain at all, then you need to start removing activities. And it's going to be removing those activities that put you beyond that level of pain, which is unfortunate if you're an athlete. Sometimes that does mean taking a step back, resting, and taking a break from playing a game or taking a break from practicing. But there is a middle ground. There is some compromises you can make. You just need to have a clear objective path to getting better, as opposed to just addressing this all willy-nilly and just guessing. There are objective measurements that you need to make, and someone who knows how to address this issue will give you those objective measures. So that's what I'm giving you in this general statement right here, is a little bit of a compromise. No increasing pain from your current baseline or lingering pain that is increased from your current baseline level of pain. We need to get this under control, where at rest, you're at somewhere between a 0 to 3. If it's above that, we have to do different strategies, which resting may be one of them, to lower that pain level down to a reasonable amount that we can start addressing it. Isometrics are one of the best way that you can start working someone's pain early on, especially even if they do have high pain levels. So this is some of the compromise that we can make. Isometrics are going to be for everyone who is dealing with a hip labrum issue. Stretching is just going to be for some. Eventually we'll get into concentric and eccentric. That basically just means lifting in the shortened position and lifting in the lengthened position. We need to be comfortable doing both before we push any depth, range of motion of an exercise. And we'll, again, give you examples of all this later on, because I know if you're not in the world of physical therapy or personal training, strength and conditioning, this might be confusing for you right now. Just wait till we get to some examples. And lastly, impact training. Again, at the final stage, this is what's going to help you return to sport. Impact and plyometrics, these progressions are a must. The muscle responds to slow speed. Tendon, ligaments, and labrum are going to respond to fast speeds because of the stiffness that is required of those tasks. Which is also to say, if you're dealing with high amounts of pain, then you should not be performing these type of movements that apply a lot of impact, apply a lot of speed and abruptness to the movement, because those are things that are going to increase your sensitivity if you do them too soon. So training is going to look different at every stage in every person's goal. This is why you should have a guide that helps you walk through this. At the end here, we will give you a chance to work with us if you so choose to, or again, these concepts are things you want to think about when you go and find a local PT in your area as well too. So what this looks like in practice. Isometrics, you're going to be doing 4 to 5 times per week until the impact exercises start. In which case, then you can start backing off the isometrics at that point in time. Again, isometrics for all, stretching for some, but stretching is going to be at the end stages as well as impact exercises. Concentric, eccentric exercises, this is your squat, lunge, deadlift, these type of things. They're going to be in the middle stages. You're only going to be doing them 3 times per week. Stretching will be 3 times per week, but it's only if appropriate and the pain level at rest is below 3 out of 10. If appropriate, that means you are actually stiff. We'll get into what that really means here in just a moment. So, when to stretch? Here are some rules to consider. Tightness ultimately is a sensation, and that's why it is misleading. You need to understand that gymnasts still feel tight in the splits. The majority of people in this world are not capable of doing the splits. So is the gymnast truly tight, or is tightness just a sensation when you take the muscle to its end range and it's been pulled taut? So taut is maybe a better word, because tightness is just a sensation. It gives no info on the distance of motion that you have gone through. So we need to understand what textbook normal distance or range of motion is and apply that to somebody's sensation of tightness to determine if they truly are tight and need to be stretched. If you are somebody who wants more because you are one of the few that needs it for their sport for a performance reason, or you just enjoy yoga or something like that, know there is a risk reward and there are trade-offs. You can overstretch, and I've seen just as many people get hurt stretching as I've seen people get hurt lifting in the weight room. It's not the panacea for recovery that everybody wants you to believe online. So some hip range of motions to consider. Hip flexion, 120 degrees. You should be able to take your knee to your chest at around 120 degrees without much substitution from the pelvis or lumbar spine. Hip extension is 10 degrees, which actually isn't as much as what you think you need based upon what everybody in yoga would have you believe, that you need to get your leg way far back behind you. There's really not that much range of motion that's actually necessary for most tasks, even sprinting, running, jumping, and things of that nature. Rotation, we don't want to just look at one direction of hip external or internal rotation of the hip. There's a 120 total degree arc of movement that should occur there are pretty darn close to it. So someone could have more internal than external. Someone could have more external than internal based upon their body structure. That's why we look at the total arc of movement to determine if they need actual more flexibility. Now that might be hard for you to test those things out, especially if you're not a clinician. So some things that you can do just from a movement and position standpoint to understand, do I need more flexibility? Should I be stretching? Or do I have enough flexibility for the majority of tasks that's going to be asked upon me, except for some extreme circumstances such as gymnasts or dancers? So here's some objective tests that you can make. A seated toe touch. Can you perform a seated toe touch? That's the old school sit and reach test. The knees stay straight, reaching, trying to touch your toes. Crisscross applesauce, sitting. How comfortable do you feel sitting in both of these positions with the right leg over the left and the left leg over top of the right? How comfortable do you feel in that position? Or do you feel like you got to get out of that position the moment you sit down in that position? That's a problem. Likewise, the 𝐏𝐫𝐤𝐨𝐰𝐿 posture, used common in the martial arts. How comfortable do you feel with your toes tucked underneath of you, your knees bent fully, and sitting your butt to the heels? This is another range of motion test you can do. In addition to the seated toe touch with the knees straight and a curve through the back, I also like to do a crisscross toe touch, such as pictured here, which looks at a little bit more hip internal rotation and adduction of the hip, so it gets a different plane of motion. You should be able to touch the floor with your legs crossed, right over left and left over right. So some beginning exercises to consider. These are the isometrics that eventually lead to the isotonics. So all of these exercises you can do just holding the posture. You do not have to move. And then eventually we can take them into moving through a range of motion. So a reverse clamshell is a good example here. One consideration that you might want to make is putting a yoga ball or a yoga block in between the knees to gap this a little bit more. That helps you feel it in the glutes more so than the front hip flexor or TFL area. Spacing those knees apart oftentimes helps those who feel like they're going to cramp up. But you can just hold this as an exercise, feeling the tension in the hip and building capacity and capability back up into the hip again. Or you can move up and down, and that would be the isotonic version of the exercise. Likewise, a clamshell, opening the knee out to the side. I can just hold this position in standing is harder than if I was laying down on the ground. And then after we get comfortable in the isometric position, we're going to also add the isotonic, which is moving the leg in and out. And again, you could do that in standing or laying down. When you're standing, you're going to be working both glutes. It works this stance leg glute just as much as it does this moving leg glute. So the standing version is always going to be harder than side lying. A big exercise that I really like is a side plank, but it's a star side plank. This one is key. You could simply do the band exercise where you lift your leg up and down, laying on your side again. But for more advanced situations and people who are capable of doing it, and oftentimes it's sooner than you think because you can modify this by going to somebody's knee instead of the foot. You can perform this for 10 seconds all the way up to a minute, which is, again, the time frame that we perform these isometrics for. But when you lift this top leg up, it's going to be working that glute med more. And that's going to be your fatiguing point. Your limiting factor and how long you can hold it is your hip as opposed to your abs and upper body, which is usually the case for if both legs are down on the ground. So a star side plank, either from the knee or from the foot, is a great exercise to work hip abduction or that glute med. And then when we get to the isotonic, you can actually add a pulse where the body kind of dips up and down, and that can be a progression to the exercise. We're down here to the figure 4 isometric. That is down here in the bottom left-hand corner. You're laying on your stomach, and you can see one leg is straight, one knee's flexed up, and the ankle is out to the side here. And that's that letter or number 4 that is drawn. That's where the exercise gets its name from. You're going to put a ball underneath the foot here, or a pillow or something, just to elevate the foot a little bit. And then you're going to lightly to moderately push that foot down into the pillow or a ball that's squishy. That works best. And you're going to feel your piriformis kick on here at the glute while you try to keep your hips facing straight down to the ground. Don't roll your pelvis to the side. That's a great exercise, again, to hold 10 seconds at a minimum if it's super sensitive, all the way up to a minute, and then you can progress beyond that later on. So again, these are all great starting isometric exercises. Down here we have an adductor squeeze, progress to a Copenhagen plank. So you see the Copenhagen plank down here in the bottom corner. That is with the hips up off the ground and the leg fully straight. You could go to the knee to make it a little bit easier, or you could just lay on the ground and squeeze a ball between the knees to make it the easiest yet. So depending on where somebody's at, their capability and their pain sensitivity, you can always start somewhere. And then surprisingly, actually, wall sits are great for labrum issues as well too. Just getting into that 90-degree wall sit, typical position, back against the wall, butt sits down to 90 degrees, your thigh is parallel with the floor. That works the rectus femoris, which attaches to the anterior aspect of the hip. And so that is a great exercise that you can, again, start from 10 seconds, build all the way up to a minute, do for 3 sets. And then we can even progress it to single leg, making it more challenging as time goes on. A couple other isometrics that we tend to lay out for people in their programs is a long lunge isometric. But all these are things that you got to be careful of with people who are hypermobile. So they might not be the best for people who have a lot of mobility. Long lunge or a loaded couch stretch. So right here you can see this person's way beyond 10 degrees. Again, I would call that hypermobility, and you need to make a conscious decision of the risk reward that is going to be taken on to get into this position. Some people have the genetics that will allow them to get easily into that position. Other people do not. So you need to understand who you are and what you're trying to accomplish before you try shoving yourself into this position. But it is a good exercise to do. It just is in moderation, and you don't need to take yourself to extreme positions. Likewise, we can do this with a standing lunge. This is more of an average flexibility kind of position that you would see. That leg's behind you, the knee is slightly bent. The person is thinking about holding that position for the 10-second to 60-second duration. They're sort of pulling back with this front leg and pushing down with this back leg to engage the hip flexor in the back leg and engage the hamstring glute on the front leg. We're holding that contraction for 10 seconds minimum, 60 seconds at the longest. Pigeon stretch. This one, unfortunately, just gets prescribed all willy-nilly to any number of people with a clinician who doesn't know what they're doing. It is a good stretch. It is good for people who have stiffness, but there are some people who are very hypermobile and they can really jam themselves into this position. Alignment does matter with this position. Don't shove your knee out to the side here. You want to keep that knee straight in front of the hip. That will feel most comfortable on the front aspect of your hip. Someone who lines their knee way out to the side here and gets really wide with this to drop their hips down oftentimes irritates the front of their hip. So you need to know how to do this exercise correctly. A yoga block works well for those who are stiff to give them a point of stability when they're trying to do this exercise. And then for those who are really stiff, we can go to the ground and just work the leg at a 45-degree angle. But again, alignment matters here. The sternum, knee, and back foot should all be in a nice straight line as if you're walking on a balance beam, and that helps you set up, again, to avoid that knee being real out wide and placing any undue stress on the anterior hip structures. That can sometimes cause a snapping hip sort of symptom or just a achiness to the front of the hip after doing it. So all things to consider. In the toe touch, we mentioned how doing a toe touch, a standing reach, a cross-legged toe touch are good stretches to do for those who are stiff. Someone who has a lot of hamstring flexibility but doesn't have a lot of low back mobility, this seated variation can actually be good to get the SI lumbar spine to start flexing a little bit, which, contrary to popular belief, flexing your lumbar spine is very safe if you do it in the right manner. Obviously, you see someone doing it here more aggressively. They've built up a tolerance to doing it before they've ever tried this. Don't rush into this. But it's a great way if someone can touch their toes. Say we go back to this standing toe touch here, and when they do this, you see a very flat back. So they don't have that nice even curvature to their back. They have a very, very flat back, but they get all the way down to the floor. That's somebody who has very flexible hamstrings, but they don't move their back a ton. And so something like this might be useful to get them rounding their spine if they're not capable of doing so, if their spine is stiff, but their hamstrings are not. So again, individual circumstances do change this. Now we've moved beyond the isometrics and we've got into some different concentric tasks. So again, you'll see this laid out in the PDF that I'll mention here at the very, very end of this, of general workout that we have for people that is very specific to the different stages of progression that someone goes through in the rehabilitation process. And you'll also have the ability, again, if you want to work directly with me online, we'll talk about how you can get access to me one-on-one. But concentrics, star side planks pump. So this is going back to the star side planks that we did here previously, where you pump the hips up and down. This is adding movement to the exercise as opposed to just an isometric. Sit-ups with feet down on the ground. This is your classic sit-up exercise, but we're not holding the feet with our hands. We're actually using our abdominals and our hip flexors to pull us up. We're not using momentum, and we're not using a chair or something to give us leverage at the feet. or use our shin muscles to help pull us up. We are using our abs and our hip flexors to actually complete the sit-up. So keep your feet down and do not hold your feet down. If you can't do this, you can use a band or a cable as assistance to kind of pull yourself up into that position. Another version of the sit-up that I like is the butterfly sit-up, shown here on the right hand side. This one shows the sit-up motion, but again, the knees are out wide in kind of that butterfly stretch position. So the goal here is in a stretch, it's just using your adductors and inner thighs to complete that sit-up, more so than your hip flexors, which a typical sit-up uses the hip flexors and the abs. A butterfly sit-up uses the adductors and the abs together. Copenhagen planks, we already went over those, but instead of holding, now again, you're pumping the body up and down with the hips. Seated hamstring curls and stability ball hamstring curls are great exercise to work the hamstrings. Likewise, seated knee extensions are a great way to work the quad, as well as that rectus femoris again, that attaches to the anterior aspect of your hip. Karate Kids, here's another one that hits that rectus femoris really hard. You got to be careful of not overdoing this or rushing to this one, because it can feel kind of crampy in that front hip. But you're trying to get your hip up to 90 degrees, and then once you're here, you're going to kick the leg out. Now, I don't care how far you kick the leg out. You could kick out just about 45 degrees and I'd be happy. Somebody who's really stiff isn't going to get very far. Somebody who's really mobile probably will get much further, but you're going to kick outward. You could do this just balancing with one leg straight and kicking out against gravity as resistance, or you could put a band around your ankle and knee here and kick out into the resistance of a band. Leg lowering is in the bottom right hand corner. It's just an ab exercise where one leg is up towards the ceiling, one leg is lowering down to the ground and lifting back up again. You should feel your abs and hip flexors working with this exercise. The trick here is this top leg oftentimes will want to drop down for people, and so it's actually working the top leg as an isometric while you move your moving leg up and down, doing an isotonic with the opposing leg. A reverse squat is another ab hip flexor exercise. It's pictured here in the upper left-hand corner. This is where you use a cable machine and an attachment to attach to the feet, and you pull the knees to the chest, keeping the low back and the butt flat on the ground. Pull those thighs up as high as you feel comfortable, keeping your legs in close together and against as much resistance as you feel comfortable while still going through your full range of motion. So you don't want to add so much resistance that you can't go through your full range of motion that you can do without any resistance. The resistance should match what you can do body weight, which is why I like a cable machine better than a band, because a band's going to accumulate more and more tension the higher and higher you get, which is unfortunate because oftentimes that's where the people are the weakest, is when this muscle is shortened the most. So that's why the cable machine is ideal, and I don't really like all these banded marching versions that you see people do, because the resistance accumulates so much that it causes the range of motion to start being restricted as they perform the exercise. So you want to go through whatever range of motion you go through body weight, that's what you want to go through with the cable machine. Eccentrics, this just means going down slow or lowering slow. So these are some common exercises that you'll see. Not everybody thinks about these as eccentrics, but again, it's just going down into the squat, but lowering yourself down. Now, someone early on in a squat might do a box squat because they don't feel comfortable getting all the way down parallel to the floor. But that's again where a wall sit can come into play, and you do an isometric at a deeper range of motion, while an eccentric, you go through a modified range of motion. Same thing with the tap downs. You could start at a 6-inch step, build up to a 12-inch step. You can then go up to a 24-inch step, depending on how tall you are. It's basically just a single leg squat, tapping down on the outside of a box. And again, you get links to all these videos if you sign up for our PDF workout program. Walking lunge, that one's pretty self-explanatory. It's just a walking lunge, again, going down slowly, trying to tap the back knee to the ground. RDLs, Romanian deadlift, again, you should know what that is. If you don't, look it up on YouTube. You'll find a ton of different variations. We have a video tutorial of that on our YouTube channel. Reverse Nordics are pictured in the upper right hand corner here. You're kneeling down, keeping the back straight as you can, hips extended, and you're trying to lower down as deep as you feel comfortable. Some people can get all the way down, butt touching the heels, and the back is parallel with the floor. Not everybody's that flexible. So start with a bench, tap the bench, and gradually work your way lower and lower. And you can use a band here or a cable machine as assistance to help you get out of that bottom position and to help you get deeper into the stretch. And then when you really get good, you can remove the band, or I like the cable machine again because you can just start taking 5 and 10 pound increments of assistance away. Again, whatever you can do body weight without any type of resistance or assistance, you should be able to do with assistance, you should be able to actually go further. As you come out of the bottom position, you're thinking about pushing the shins down into the floor. And likewise, as you lower yourself, again, it's an eccentric contraction, so you're still thinking about pushing the shins down into the floor the whole entire time, so you maintain tension in your quads and your rectus femoris as you lean back and do the limbo and then drive up out of that bottom position. We have a tutorial of that exercise as well on our YouTube channel if you search Reverse Nordics. One postural consideration that you may take into note for a hip labrum issue is those who deal with a snapping hip. Again, these tend to be more of your hypermobile individuals. It's where this greater trochanter kind of rolls over top your hip flexor and you feel like a guitar string strumming. And so it tends to happen in more hypermobile people, but it can happen in people who have stiffness as well too. And a lot of this has to do with flexibility if you are stiff, but alignment if you are not stiff, and alignment does matter if you still are stiff as well too. So what I'm going to show here is someone standing where their feet are wider, more abducted, and you can see, especially the right side here, is more toed out. External rotation, or toed out, or abduction, or feet really, really wide, is going to put more tension on this hip flexor. And especially if you're tight or hypermobile, you can really get your leg out into external rotation and abduction. That's where you're going to start feeling the strumming. One position that oftentimes people feel strumming is this leg lowering exercise we talked about earlier, where you're lowering the legs up and down, or possibly this reverse squat as you start extending the legs out. That's where people will start feeling the snap occur. Going back, this is also why I tell you to keep your feet narrow, because oftentimes that reduces the snapping simply because of the alignment. So looking here on the right hand side, see that the ankle joint is stacked right above the hip joint. Most people don't realize your hip joint is much more closer to midline because they feel on the outside of the hip and they feel the greater trochanter here. We have something called the neck of the femur, which means there's this angle that happens. So the joint is actually much more closer to midline, and actually if you draw a line all the way up to your ears, it kind of fits in line with the ears. So if you think about the stance width that you should be doing standing throughout the day, your stance width should be right around ear width apart or head width apart. That's one way to look at it. Because if you go wider and toe out again, you're placing more tension on that band, which could cause more of the strumming. It's probably not a huge problem, it's just more of an annoyance for people, but again, it does lead to telling you tendencies about how you move, your body awareness, and what muscles you like to activate or utilize more than others. Likewise, if you're sitting all the time, a lot of times you sit with the knees spread apart and the toes toed out, and you're just always at this 90-degree angle of hip flexion. Again, you apply that to extending the leg, and then you can cause the hip to start snapping, which is why, again, from a flexibility standpoint, I also want you to feel comfortable in the 𝐸𝐫𝐫 position. Still the 90-degree hip flexion, but it's much more of a narrower stance. Your knees are closer together. It's more of what we would call internal rotation in a slight anterior tilt of the pelvis, versus sitting in a chair is more of a posterior tilt, hip abduction, external rotation of the pelvis and femur. In standing, looking at it from a side view, this is another thing to consider. It tends to be more in females, but males do it too. Thrusting the hips forward and leaning the shoulders backwards. So again, if you draw a straight line from your heel all the way up to the ear, that also is relevant from a side view standpoint too. You should see that those are in alignment and it crosses right through your hip joint. If you see that hip joint way in front of the plumb line running down to your lateral malleolus, that means you're applying a lot of pressure into the front of your hip, and you're essentially starting in a hip extended stretch position already. And if you really go back and consider that 10 degrees is a normal amount of hip extension right here, but then you are living in that hip extension position 24/7 throughout the day when you are standing, that's where problems can ensue, because you're just always putting pressure into the front of your hip. And because you're always putting pressure into the front of your hip, because you're standing with your hips thrusted forward and your hips out wide and the hips toed out, and you're sitting in that same position all 24/7 too, then that's where we can have this sort of unknown mechanism of injury where you just wake up one day and all of a sudden you're having pain in the front of your hip and you're wondering what the hell went on. So alignment is a factor and you must consider it. For some, it's more of a factor than others. So I just wanted to bring it up here as one concept to consider, but it's not the be all end all. And you need to, even if you are dealing with these issues, consider everything else that we talked about in this lecture as well. All right, so final step, we mentioned getting onto plyos and impact, return to sport. We need to start this when you know concentric, isometric, eccentrics do not create any sort of lingering pain. You're working through a reasonable amount of discomfort if you do have any discomfort, which is ideally no more than a 3 out of 10. And again, as soon as you stop that exercise, that pain should not linger on. You should be able to walk it off and feel no different than what you did prior to starting the exercise. If you perform an exercise and you wake up the next day and you think to yourself, I don't want to do that exercise again, you're probably pushing yourself too hard. So we don't start impact until you know that you can get away with the majority of these concentric, eccentric exercises. You don't need to do them all. You don't need to necessarily do them through a full range of motion, but you need to be tolerating them and doing them in your program. Also, the secondary rule of thumb, so you have to have both of these, not just one or the other, is our resting pain should be controlled to ideally a 0 or 1 out of a 10. And again, with exercise, it's no more than 3 out of 10. So both of these rule of thumbs should hold true before you start impact training. What does impact training look like? Well, the simple one that you'll see a lot of people do, and I'm a big fan of these, you need to be doing these. It's any number of two-legged jump or a single leg jump. There's a lot of different varieties to make it easier or harder for somebody to give people multiple entry points. So again, it needs to be scaled appropriately. These are probably the easiest ones to be doing. But we can get more aggressive with it with these different shock exercises. I've got 2 of them pictured on the right-hand side here, but again, it's just different angles. So hip flexion shocks, that would be kicking the leg straight forward, toe point straight forward. Think of kicking a soccer ball. We have one with the toe out, that's down here, hip flexion plus external rotation. We have one where the foot is straight ahead, which is just straight hip flexion. So you're going to kick your leg back and then you're going to kick forward into this heavy resistance band that I have hooked up to the bottom of the J-cups. And it's going to give you a jolt, an impact as that leg comes down and it hits the cord. So that's an exercise that we want to be considering, both external rotation and with the foot straight ahead again. Another one is hip adductors. So you can see me standing here and I'm aggressively kicking inward into the band. So this is the hip adduction shocks. Vice versa, hip abduction shocks is just the reverse of that. I'm kicking out into the band and getting the shock in that outward direction. You can do this seated with hip internal rotation and hip external rotation. And then you can do this also with hamstring and knee extension machines as well too. You can kick out into a seated hamstring with both legs and then kind of catch the swinging arm as it comes back down at around 45 degrees with your knee, with the pad coming down to the foot, and catch it on one leg. So that would be a knee extension hamstring shock. Vice versa would be a seated hamstring shock, where the hamstring curl is you're pulling it down with both legs, and then you quickly let the weight come back up, but you catch it before it gets all the way back up with one leg. A more aggressive version is a hamstring hip extended shock, which is a straight leg bridge where you're switching your legs back and forth. So these things are all exercises that apply shock and impact to the muscle tissue to get you ready to absorb shock and impact when you go back to playing sport. Again, these are more advanced. The easier ones are just the jumping exercise. But if we're really trying to build a robust and resilient athlete, I would consider some of these other ones. But again, you need to make sure that you're doing well from a symptom standpoint before you ever start trying something like this. All right. Hope you found this video helpful. Be sure to like and subscribe to the channel if you did. Comment fist bump if you found it useful, so it helps the algorithm pump this out to more people. If you got questions about some of these concepts, feel free to dive down below in the comments section. I'm very active down there and I'm happy to answer some questions and promote more discussion. If there's other videos you'd like to see, let me know in the comment sections below as well. If you're a rehab clinician or strength coaches, we have a course that is a Sports Rehab Expert certification course. It combines rehab, strength, and plyometrics that help make more durable athletes and human beings. So you can sign up for that at sportsrehabexpert.com. If you're an athlete or active individual who is dealing with some pain, we have an option to help you. We have our whole entire program. It's a general program, but it applies to most people, and we lay it out into different stages through the program. So it's a full-blown rehab program for you with the best all-around qualities we can give in a PDF format. You can get that by emailing me, greg@sportsrehabexpert.com, or visiting our website, sportsrehabexpert.com. Or you can get a monthly custom workout plan that is delivered to you via our training app. You get your own workout every month. It's updated. You also get the ability to text, ask me questions, send me videos for form coaching and things of that nature, and I'll monitor everything that's going on. So depending on how much help you feel like you need, we got two different options, two different price points. Again, email me, greg@sportsrehabexpert.com, to check those out, or you can go to sportsrehabexpert.com to visit our website and check those out as well too. Option 3, just one final option here, is in-person sessions, both online or if you're around the Ann Arbor, Michigan area, you can visit me. My clinic website is annarbor.physio. Again, for online clients, you can go to sportsrehabexpert.com or email me. Again, all these are 3 different price points, so depending on what you feel comfortable with, we can help you at any stage of your any stage or any circumstance. So just, again, reach out to me, and happy to point you in the right direction.